With cases continuing to fall, mask mandates are being lifted, but all of this change is leaving people with a lot of questions, like where should we still wear a mask and where is it okay to take the mask off?
Dr. Frank George here to explain why it's not an all or nothing issue and where you can find information to help guide your mask wearing decisions. Doc?
Yeah, Kim and Devin, so there appear to be generally three camps when it comes to masking. There are the non-believers who feel it's just theater. There are the genuinely concerned who aren't giving their masks up. And then there's this sort of large middle group who really don't know the best answer. So to help, the CDC has created a simple way for anyone to figure out their local risk. And while it's not perfect, they have clearly invested time and thought into building something that's useful to provide guidance to help us all move forward. The risk level is determined by the CDC in every county in the U.S. by factoring the rate of new cases, the rate of new COVID hospital admissions, and the percentage of hospital beds being used to treat COVID patients. Areas are then given a low, medium, or high level of community risk, basically green, yellow, or orange on a chart or map.
You do not have to wear those masks. I mean, please take them off. Honestly, it's not doing anything, and we got to stop with this COVID theater. So if you want to wear it, fine, but this is ridiculous.
That was Florida Governor Ron DeSantis at a media event in Tampa, which is located in Hillsborough County. The location is important because different counties have different levels of risk. Using Florida as an example, there are large areas in the green, low-risk category where masking is not necessary for the average person even when indoors. Looking more closely at Hillsborough County, though, you can see it is still orange, or high risk, meaning it is recommended that people wear a well-fitting mask indoors, in public, regardless of their vaccination status. Now, looking here in Michigan, you can see Wayne, Oakland, and Macomb counties are all green, while St. Clair County is still orange or high risk, and Washtenaw County is yellow or medium risk. Now, relative to masks, green means masks are optional and dependent on your personal situation. Yellow means if you are at high risk for severe illness, you should talk to your healthcare provider about whether you need to wear a mask and take other precautions. Orange means it's time to wear a mask again indoors in public. Now, I really just have to say, courtesy and civility go a long way. Masking is not always necessary anymore, and the CDC is really providing tools to help us all be smarter about raising our guard when it's necessary, but also relaxing it when it's reasonable. Now, I'm also going to throw in my personal opinion here. If someone wants to wear a mask, and honestly there might be medical reasons that just aren't obvious to you, that's their choice, and it's really just uncool to make someone feel awkward if they wear one.
So right, Frank. Is the CDC, though, trying to suggest that you follow their guidelines based on where you live or where you work or happen to be at that moment?
Well, that's an interesting kind of quirk in the system. We know, of course, everyone freely moves from county to county, and those green, yellow, and orange, they're not rigid borders, but it's really kind of still helpful to get everyone on a similar page when it comes to precautions. I think at the end of the day, it really comes down to common sense and common courtesy, which unfortunately aren't always that common these days.
Yes, sadly so. All right, Doc, thanks.